if a kid was abusing certain drugs, could you look at someone's eye and notice something that changes in the eye?
Well, yes. First of all, if a child is using certain types of drugs or a patient is using drugs, you could look at the pupils. Pupils can be very dilated with certain drug types, and they could be very small with other drug types. So certainly if a child's pupils are extremely small, you would be suspicious of certain drugs, and if they're very large, you'd be suspicious of other drugs. For instance, cocaine would make your pupils get very, very dilated. Okay? The other thing that you would look at in a patient who might be abusing drugs, particularly intravenous drugs, is some of these intravenous drugs have talc in them. You could actually see little talc emboli in the retina along the blood vessels if the patient is using certain intravenous drugs. So there are ways of looking in a patient's eyes, and the eyes tend to be the windows of a patient's body, to tell if they're using certain intravenous drugs and to actually check to see if they're using drugs which affect the pupils.